So today we're going to do some Ultherapy, and we're actually going to treat me. So we're going to have Cheryl, who's over here. Hi, Cheryl. Who is our expert Ultherapy artist, do my neck and chest. I've started to notice a little bit of early aging in the chest, probably associated with laying on my side when I'm sleeping. But I believe that the Ultherapy will really help to do some early tightening and lifting, and I think it also may help a little bit with the texture of the chest. I have done Ultherapy twice on the lower face jawline to right here with really good results. I was very happy. And so we're going to do a little bit of prevention for the neck and chest. We're building up collagen stores to save for when I will need them as I continue to age.
Every treatment I do is customized for the patient based on their goals and based on what I see, and then I tailor the treatment based on what I'm seeing on the ultrasound image as well.
Cheryl, are you using the 1.5 millimeter tip?
I will be using that 1.5 millimeter tip on you. My assumption is that you have a beautiful dermis, and my goal will be to get that energy in right at the bottom of the dermis where the connective tissue connects to your subcutaneous layer. So it's kind of a mathematical equation. You want to get X amount of energy in per square centimeter. So I am marking the areas that I'm going to be treating to ensure that I get the right amount of energy in each section or quadrant.
And I just wanted to make a little comment about this. This is Pronox. It's nitrous oxide. And it's great because it is a light sedative usually used in dental offices. That's where you may know it from. And it goes on fast and it turns off fast, so you can drive yourself home after the procedure. Ultherapy is great, but just like all of the wonderful procedures, they can have a little bit of pain associated with them. So if we can keep the patient comfortable, we're happy, the patient is happy, the procedure will go better.
The goal is to make sure that I'm putting this energy in at the exact right depth to cause neocollagenesis, because if I'm putting it into her bone or muscle or platysmal band, that's not going to help tighten the skin. So the key to Ultherapy's success is all about this image and people, the Ultherapists, being able to read the image properly. So I'm just going to scan through here, decide what depth I want to use, and then make my plan of attack. She has great collagen for one, and a really nice thick dermis, not a thick subcutaneous layer, which is one of the reasons why her platysmal band is not really deep, because she's so lean. She's got a beautiful dermis though. Holy smokes.
Has anyone told you that before either?
No, but I'm happy.
And a really thick epidermis too, which is great.
Good too.
It looks like a railroad track almost. See how it's double white lines there? So it's 1.5 is going right into the top. So it's laying down those little thermal coagulation points right into the top. That's a little bit of subcutaneous layer right above that. But I'm just going to put it right in at the very top of the muscle. So you're going to get great results.
How's it feeling so far?
Totally fine. Yeah, it's not bad at all.
This is Cheryl at Pacific Dermatology Cosmetic Center, and we are done with Dr. Reichel's Ultherapy of the full neck. She has a nice moderate amount of erythema, nice and even all over, and she was a great candidate for this, and she's going to do great. She can go out for dinner tonight, business as usual tomorrow, no downtime whatsoever, and again, this is a one and done treatment, so she won't even have to see me again. Well, she'll have to see me again, but she won't need another treatment for at least another year if she wants to have another one.
All right, well, thank you very much for being with us today for the Ultherapy session. Message us or call us and come in for a consultation. We can decide if Ultherapy is the right thing for you. If not, we will be able to talk with you and figure out what the best plan is. Definitely give you honest opinions and ideas of what's going to be right for you for this rejuvenation.